Welcome to another clinical snippet video. Today we have a case of quadriparesis with some interesting findings. As you can see, there's complete wasting of the thenar and hypothenar muscles of the hand. Now when we elicit the deep tendon reflexes, first we elicit the biceps brachii, the root value C5, C6. You can see the reflex is absent. Now we will elicit the triceps reflex. You can see the triceps reflex is absent. Now we will elicit the brachioradialis reflex. So ideally, if the brachioradialis reflex is present, the arm should flex. Instead, there is absent of contraction of brachioradialis muscle. Instead, there is flexion of the fingers. So now we elicit the finger flexion.
flex, finger flex, flex.
Now you can see the finger flexion is exaggerated. So in this patient, we see the biceps reflex, the root value C5, C6, brachioradialis, the root value C5, C6, and the triceps, the root value is C7. All of them are absent. And the root value of finger flexion, that is CA-T1, that is exaggerated. As per the cardinal rules of cord compression, at the site of the lesion, we find lower motor neuron signs, that is absent deep tendon reflexes. And below the site of lesion, we find upper motor neuron signs, that is exaggerated deep tendon reflexes. So in this patient, the biceps reflex with the root value of C5, C6, triceps with the root value of C7, and brachioradialis, the root value of C5, C6, all are absent, showing lower motor neuron signs. And the finger flexion with the root value of CA-T1 is exaggerated, showing the site of lesion being C5, C6. Thus, we conclude that in this patient, the segmental site of lesion is at C5, C6 to C7.